Anti-Aging Longevity Clinic for 8 years now. So we've been in the field of PEMF, biohacking, regenerative medicine for some time. And we've been supporting our programs with PEMF. So we were really excited to see the second generation PEMF and have been integrating it more into our clinic. I want to echo Dr. Jeff in saying that, when we're using this mat, we're not treating anything. We're actually supporting the body's own ability to heal. Our cells are already programmed for repair, regeneration, waste management. Our body's an amazing symphony or orchestra of healing potential. Sometimes we just get in the way of that. So this mat, we've incorporated it into a lot of our programs. We are doing IV nutritional therapy with it for intracellular absorption and molecule activation. We do a lot of regenerative medicine where we're fully supporting that. There's a preparation phase, the procedure, and then a support phase, and this mat's integrated in all of that. And if I could, I just wanted to share 3 cases that are sort of top of mind, and they cover different things. And it's interesting to me to experience the difference in this mat versus our standard PEMF that we were using. So the first case was for nervous system balancing. And this was actually a woman who had fallen and a rotator cuff tear. She was very apprehensive and nervous about the procedure itself because her shoulder was in pain. She couldn't imagine having a needle placed into the shoulder of pain. So I had my staff do a balance on her before we even started, the procedure at all. And she just sort of melted into the chair, and she became so relaxed, in a very relaxed state. Previous to this, she was asking me, "Are you going to sedate me? Could you put me to sleep for this?" And when I asked her after the procedure was done how it went, she was like, "That was 100 times better than I anticipated." And I feel like a big part of it was that she was able to relax through that procedure. And then we always choose transform on these joints afterwards to really help with activating everything that we've done, the platelet-rich plasma or fibrin or stem cell exosomes. So I feel like a large part of healing, which also Dr. Jeff touched on, is that sympathetic, parasympathetic nervous system state. She was definitely in fight or flight when she arrived. She left in a parasympathetic state, which will fully support her healing and being able to kind of repair and regenerate. And then the next case is a woman. She's in her 70s, very in tune with her body. She's a massage therapist and very sensitive to EMFs. In fact, she had a cell tower placed on her farm in mid-Michigan, and the whole family actually became sick, and this case went to the Supreme Court. So she is not able to tolerate any sort of high-intensity PEMF whatsoever, but recently had a trip to Florida where she fell onto her right hip when she slipped, and it was uncomfortable, but for 2 days she tried to do swimming and kind of loosen it up. Her travel home to Michigan, however, proved to be difficult, and everything started to tense up. She developed sciatica all the way down to her ankle on the right, and spasms up her back to her base of her skull. She had gone to the chiropractor 2 or 3 times, massage therapist, and then came to me for cold laser therapy, which had worked in the past. However, we did 2 sessions, and we weren't really moving the mark with her this time. So I had recently got the mat at that time, and I said, well, let's try this, because I knew she was sensitive and it was real mild. So we did a balance and then a transform on her spine, and she, within that first session, noticed a difference. She stood up and she said, "Oh, wow, it's only to my knee now. The sciatica pain is now all the way to the ankle." And she had a trip planned to Italy, which she's there now, but I said, "Why don't you come every day for 4 days before you leave for your trip?" Because she was considering canceling her trip. And by the 4th day, she was, we had her on a massage table doing the PEMA mat, and she actually got up and from the table when I was talking with her after her session, and I was like, "Well, you got up very easy." And she's like, I don't have any pain." She's like, "I've been laying here the whole time thinking, how am I going to get up from this table?" And so she is on her trip. She did get a little, the small version to take with her, because she felt like this was very important for her and her family's health overall. But the most interesting part of that case to me was that 4th day, she said, "I know that this is helping me with my discomfort and tremendously." And she said, "But something else is happening at the cellular level, I think," because we, all of our clinic is based on cellular health. Everything begins at the cell. If you can get the cells working, functioning appropriately, then the tissues, the organs, the systems, the being can. And she said she's still doing some paralegal work. She said, I can focus and concentrate better. And her home in Petoskey is somewhat near a 5G tower, so she's always battled the length of time that she's able to stay in that home. She gets ringing in her ear, the tinnitus very bad, and she gets palpitations by the third day. And she said, I've been here for 4 days now, and I don't have ringing in my ear or palpitations. So I think that was an amazing testament of this woman and realizing, because she's so in tune with her body, how it's really working at the cellular level and changing more than just the reason she came. And the third case is a younger woman we've been working with for a few months now. She has some ligament laxity, maybe Ehlers-Danlos, but she has a lot of musculoskeletal injuries, which are out of proportion to what she does. And we've been working with her for muscle balancing and neuromuscular reprogramming. And we've been doing pretty good. She's been making slow and steady progress. And I introduced this to her for her last session, and I think that she said it best. So I'm just going to pull up her little testament here. It's very interesting. She said she wanted to update me about using the mat just one time. She said her foot definitely felt better. As for the rest of me, she said it was very strange, and I'm not quite sure how to explain it. She said it was like I've been shattered into 1,000 pieces for the last 10 years. And after using the mat, 200 of those pieces came back together. It was very subtle, but I just felt more put together. My constant tinnitus in my left ear was almost gone on Saturday. It came back some on Sunday. My back pain was a little better, and I held my chiropractor adjustment a little longer than usual. It was very interesting. And then also, I just left the clinic that she was going to get a root canal, and she said the dentist wants to wait a few weeks and see if the nerve heals on its own. So it's been quite remarkable. You know, I have more stories, but I wanted to limit the time I'm on here. I've been very impressed. I have a degree in biotechnology, and then, you know, interventional and diagnostic radiology, and we do a lot of procedures, and working at that cellular level and just supporting their health at that level and helping them get into that parasympathetic state where they can really heal. It's been pretty profound.
Well, there we go. Awesome. Yeah. So Sabine, I think we're going to